are going to discuss about the toxoplasmosis. How do people get the toxoplasmosis? That means how the people get the toxoplasma infection. So here we are going to discuss following things. The toxoplasma infection occur by one of the following. One is eating undercooked contaminated meat, especially pork, lamb and venison or shellfishes. So here what happening, if undercooked mean we are not cook well. So if we are not cook well, what happen in the pork meat or shellfishes, it containing the infective stage one, especially tissue cyst. So this when we are taking undercooked or contaminated meats, what happen? So these infective state tissue cyst enter into the human body. Then next one, accidental ingestion of undercooked contaminated meat or shellfish after handling them and not wash hands thoroughly. So in here what happening, when especially who are the people who are working in this area, that means the fork shops or meats or shellfish, when they are handling, what happen sometimes, if the shellfish or the fork meats, it contain any infective stages, accidentally we are ingesting where. So when we are handling like these fork meats or the shellfishes, before we are eating or when especially before eating, we have to wash our hands thoroughly. Otherwise if we are not wash thoroughly, what happen, if the any meats or shellfishes containing any of the infective stage, so it will enter into our body. The toxoplasma cannot be absorbed through the intact skin. So this also the one of the MCQ points. So normally skin, if any toxoplasma stages attached to our normal skin, so it is not effective. That means the skin cannot absorb the stages which are present on our skin. So when we are washing thoroughly, it's remove out. Eating food that was contaminated by knife, utensil, cutting board and other food that have had contact with raw contaminated meat or cells. So here very important, normally in our household or kitchen or hotels, whatever or wherever the places, we are using knife, utensil, cutting boards for all the cutting work in especially kitchens, the vegetable for the cutting of vegetables or sometimes fish, sometimes meats, so we are using that. So in this situation, if we are use meats or shellfishes, so we have to wash it thoroughly. What we are using for cutting purpose, we have to wash thoroughly. Otherwise, if this meat or shellfish is contaminated with the toxoplasma, the stage infective stages, sometimes it may taken by actually when we use this contaminated knife or utensil or cutting board for the and other cutting purpose like vegetable cutting or other things, so it will automatically transmitted. Then drinking water contaminated with Toxoplasma gondii, here normally the oocyst is here we can see in contaminated water. Then we take the contaminated water which are containing oocyst of Toxoplasma, so it also get infection. So accidentally swelling the parasite through contact with the cat feces that contain Toxoplasma. So here we are accidentally contact with the cat feces. If the cat feces contain toxoplasma, it will sometimes that means actually when you are doing gardening, clean the garden, so that time you have to wear your gloves, otherwise we don't know the sometimes the cat said at the feces. If the cat is infected, so this feces also contain infected stage, especially oocyst. So when you are handling the garden cleaning and other things, sometimes it's also sometimes contaminated our hands, and when we are use the contaminated hand, we can swell the parasites, right? Then this might happen by cleaning a cat's letterbox when the cat has said toxoplasma in its feces, right? Sometimes if we are if in our home we are using a cat as a pet, sometimes we arrange for the places for staying, we call letterbox. That time if we use separated place for the cats, when we cleaning these the places, the letterbox, sometimes the cats lay the feces. So if the cat contaminate the infected with the toxoplasma, these feces, when we are handling without wearing gloves, it may uh, contaminate our hands and it infect to us. Touching and ingesting anything that has come into the contact with the cat feces that contain toxoplasma. Again, here also when we are if anything's contact with the stool, cat stool, when we touching that, or sometimes accidentally we actually we don't know the cat infected by the toxoplasma, right? If we know the sign and symptom mostly, we know the cat is infected, otherwise we don't know. So when we are handling this, or when we are touching the place where the cat feces is contacted, that time we also can get the toxoplasma. Accidentally ingesting the contaminated soil. So not washing hand after gardening, or eating unwashed fruit and vegetable from the garden. So here also in your garden, when you are handling, you are not wearing your the gloves. So that time sometimes it may if soil containing any infective stages, that will contaminate our hands, and it we can swell the stage. Or otherwise sometimes when you are using when you are eating the fruit which are not washing directly when after picking the fruits, and directly when we are eating, sometimes if it contain the contaminated stages, that we can get the infection. Or same like vegetables also. The mother to child. This is we call congenital transmission. That means if mother is contaminated with toxoplasma infection, this is transmitted to the child through the placenta. If mother is contaminated, we have to check. Normally we are using torch test. By using that torch test, we can identify whether mother is contaminated or not. Otherwise we can use the IgG, IgN, ELISA methods, right? But normally if mother have any sign and symptoms, normally we will check. In the case of Sri Lanka, we will check. But other countries, developed countries, normally in pregnant mothers, they will check the toxoplasma. Next one, receiving an infected organ transplant or infected blood via transfusion through, it's rare, right? But in the case of the organ transplantation or sometimes the blood transfusion, we can get the toxoplasma. Normally in Sri Lanka, Organ transplantation, we are not checking the toxoplasma. There is a correct criteria. They will check that, especially antigens, antibody. And then if tally with each other, they will transfer the organs. In the case of blood also, blood transfusion also, there are some infectious agent they will check before the transfuse the blood or after collecting from the donors. So normally in Sri Lanka we are not check the toxoplasma in organ during organ transplantation or during blood transfusion. So these are the modes of transmission, how the toxoplasma transmitted to the human. So next one, how can I prevent the toxoplasmosis? So here the preventive measures, how to prevent the toxoplasma. There are several steps you can take to reduce your chances of being infected with toxoplasma. So there are so many steps you have to take to reduce the toxoplasma infection. So if you want to prevent any of the disease, you should know mode of the transmission. So previous slide we discussed the mode of transmission. There are 6 or 7 modes of transmission. So if you want to prevent, so you have to think the modes of transmission. First, cook food to save temperature. So here we have to cook very well. Otherwise, if you are undercooked, the half cook or raw directly, sometimes if you are take like that, when you are taking that time, actually the one of the intracellular stages present. So when we are eating that meats or foods, we will get infection. A food thermometer should be used to measure the internal temperature of cooked meat. So cooked meat, already cooked meat. So if we want to measure the temperature, we have to use the food temperature. These are actually the food thermometer. This thermometer especially made for the cooked, the measure the temperature of the cooked foods, right? So color is not a reliable indicator. So here the color change, by using the color change of the foods, we cannot decided that meat has been cooked to the temperature high enough to kill harmful pathogen like toxoplasma. But sometimes if we are use small amount of temperature, low temperature, sometimes color may be changed, but that is not that temperature not enough to kill harmful pathogen. So we have to cook a high temperature. Example, normally nowadays we are using normally in young people the BBQ. What happened in BBQ? Actually the outside we can see very well cooked one, but internal part of the foods or meats, whatever you used as a BBQ, in here at center part, if not well cooked, what happen if any pathogen is present in that BBQ, if it may be meat or fish, whatever. So if any pathogen is present, we will get infection. So so best thing, the young generation, you avoid BBQ, or otherwise you have to prepare in your home with well or high temperature. Do not sample meat until it's cooked. So this also, don't take these foods, meats until it's well cooked. Right. So here US USDA recommend the following for meat preparations. For meat preparation, USDA recommended following instruction. For the whole cut of meat, excluding poultry, so cook to at least 145 Fahrenheit or 63 Celsius. So, if you want to cook, at least the temperature should be 63 Celsius as measured with the food temperature thermometer placed in the thickest part of the meat. Then allow the meat to rest for 3 minutes before covering or consuming. According to the USDA, a rest time is the amount of time that produce remain at the final temperature after it has been removed from a grill or oven or other heat sources. During the 3 minutes after meat is removed from the heat sources, its temperature remain constant or continue to rise, which destroy the pathogen. So here we have to keep 3 minutes. So that time what happened, the temperature will increase that time and it destroy the pathogen. For ground meats, so it cook to at least 160 Fahrenheit or 71 Celsius. Ground meats do not require a rest time. Here no need rest time. So all for poultry or whole cut and the grounded to cook at least 165 Fahrenheit or 74 Celsius. Here we have to use the internal temperature should be checked in the innermost part of the highest and innermost part of the wing and the thickest part of the breast. Poultry do not require a rest time. Here also no need rest time. So freeze meat for several days at sub-zero, that means 0 Fahrenheit temperature before cooking to greatly reduce chance of infection. So here when we are using freeze meats, that means 0 Fahrenheit, so it is reduce the chance of infection. Freezing does not reliably kill other parasites that may be found in meat, like certain species of Trinchella or harmful bacteria. So when we, in the case of heat method, it will destroy all the pathogen, but in the case of freezing method, we cannot expect all the pathogen will die. So the internal temperature is the safest method to destroy all the parasites and other pathogens. So best thing this one, the heating method. Peel or wash fruits and the vegetable thoroughly before eating. So how to prevent the vegetables and the fruits if it is contaminated. So before eating we have to peel off the outer parts, peels and or sometimes or we can use the washed fruits or vegetables. Do not eat raw or undercooked oyster or mussels or clams. This may be contaminated with the Toxoplasma. So here also we can avoid raw or undercooked meats or shellfishes, and do not drink unpasteurized goat's milk. And other one, the goats also the one of the intermediate host. So if when you are taking goat's milk, you have to pasteurize or well boiled and you have to drink it. Wash cutting boards, dishes, counters, utensils and hand with the soapy water after contact with raw meats, poultry, seafood, or unwashed fruit or vegetable. So if when you are using the cutting board or utensils or the knife, so we have to wash our hands with a soapy water, and same time that means after contact with these raw materials, right? Or sometimes each and every time, best thing you have to wash all the cutting boards and utensils and the knives, right? Wash gloves when you are gardening and during any contact with the soil or the sand, because it might be contaminated with cat feces that contain toxoplasma. So when you are doing gardening, so when you are contact with the soil or sands, you have to wear the gloves. Otherwise, if soils or the sands containing toxoplasma, especially the cat feces, so it may transmit to the workers, right? Wash hands with a soap and water after gardening or contact with the soil or sands. So after gardening, so we have to wash our hands thoroughly and ensure that the cat litter box is changed daily. The Toxoplasma parasite does not become infectious until 1 to 5 days after it is shaded in a cat's feces. So here what happening, so every day if you are changing or cleaning the litter box of the cat, so you are safety and cat also safety. Otherwise what happen, if cat is infected, the infect is shaded with the cat feces, even it is not infected, because this after shedding oocyst, that means immature oocyst, it become a mature, that means infective oocyst, it takes some time. So that means in environment they need some development, so it takes 1 to 5 days. So every day when you are cleaning, what happen, they are immediately removed and wash it out. But if you are take after 5, when you are washing after 5 or 6 days, what happen, even if cat is positive for toxoplasma parasite, the pieces contain stages. So when the the infected stages shaded with the cat's stool, when you are doing the cleaning the after 5 or 6 days, what happen, it become infective, right? Wash hands with a soap and water after cleaning out a cat's litter box. So same thing. So each and every possible routes, you have to wash thoroughly your hand and teach children the importance of washing hands to prevent infection. So we have not only the adult children are the main the group affected, because they are always playing in the sand, soil, garden, so they are the most the risky group, right? Infected groups. So we have to teach the children the importance of the washing hands and wearing slippers. So we have to teach them to prevent the infection. So if you have a weakened immune system, please see guidance, right? So especially in the case of immunocompromised patient, it is cause severe illnesses. So if we are immunocompromised or weak in immune system, so you have to immediately follow the instruction. Okay, thank you.